master's or PhD in this material? How long have you been practicing this? What, there's those kind of questions may help a lot. Unfortunately, most of the time, it's the 3 A's that make you go to a doctor. If they're affable, affordable, and they're available, that's when you typically will pick that doctor. In the good sense, in your case, it worked for you. And the question is what they do based on a rationale, a good idea of what's wrong? And basically, are they taking the things into context that are you, not just, okay, I do this for everyone that's getting a cold. No, that's not the way it works. You have to see what will work for each individual. Again, it's not easy to find. There are many functional, supposedly doctors out there, but they take weekend courses and, then they say they're a functional doctor, unfortunately.
So as an integrative health coach myself, I look at a person one-on-one. Now, most of the people listening know only about blood tests, and some of them don't even really see the results. So when you're talking about a biochemistry wellness profile, and then going to vitamin D3, the lower range is often way too low. So people just don't really know. What does that look like for somebody listening who's not really experienced outside of the normal blood tests that they might get at a traditional Western, allopathic physician?
So it's a great question. I'm going to simplify a very complex answer into saying the following. The typical short-range blood test that the internist and family practitioner, PCPs across the country do, are typically truncated so much that you'd never be able to get a really good handle on that person's biochemistry. They're typically a CBC, a complete metabolic profile, and perhaps a thyroid profile, and even that's often shortened to what it should be. When it comes to a comprehensive blood test panel, it should include things like the following. I'll give you broad categories because typically I'm doing 116 evaluations. But it should be like when you take your car in, you would never expect someone, if you told them, hey, my car is, stuttering a little bit, for them to look under the hood and go, well, I guess it's this. You expect them then to hook up the car to, a computer and there's 150 check. I do the same basic process. So just to give the listeners a concept of what they should be looking for is they should make sure they have a full metabolic profile. They definitely should have a vitamin D3 level. They should definitely get inflammatory markers. They should definitely have all the hormones done. They should have the wear and tear hormones like DHEA and pregnenolone. They need to have tests like uric acid to make sure, because it's inflammatory as well. They need to have muscle protein tests. So there is you really want to look at all the systems. Now, on top of that, a good physiologic physician will also look at perhaps saliva. They may look at stool. They may look at urine and use all of those in combination to create the picture, depending on what the original chief complaint of the person was. But this is even compounded by the fact that when we go back to the lab work, you're so right. The lab work is skewed often. And lab work is developed with their norms. The norm is not optimal. So to go to what you said, the norm on a vitamin D3 level on a lab is greater than 30, whereas the optimal
that's way low,
way too low, and the optimal was somewhere between 60 and 100. Now that happens with a lot of things. So if you look at hormones, hormones are skewed basically to lower and lower values as the person gets older, as if to say, well, they're older, so they don't need as much. But that's not true. We want to be in that youthful state, and youthful state is basically described in one word in one sentence. One word is an anabolic state, which basically translates to wear and tear is much less than repair and restoration. As we age, that particular graph changes, and the job of like you as a life coach, as an integrative physicians, as the people out there doing this kind of lifestyle changes for folks, is to reverse that ratio so the wear and tear is much less than repair, and bring back people as safe as possible to their optimal or their youthful state. That's the best explanation we can do.
Yeah. Yeah, I'm reintroducing the talk on enzymes. They somehow got lost over the years. I know a doctor here locally who wrote a book on it in the 70s. And I mean, what is your take on enzymes?
Well, there's a couple different types of enzymes. One, the easiest to talk about is the digestive enzymes that our stomach makes that helps us digest food. I think if we use the statistic, it becomes quite evident why we need to have them replaced. So if you look at a 22-year-old and compare them to a 42-year-old, just a 20-year difference, 22 to 42, there is 1,000-fold break-off in the amount of these digestive enzymes that are produced just between the youthful person and the middle-aged person. Wow. So you can imagine as we get even older than that, it's even more difficult. And these enzymes play a very important part in our overall health. Now, in addition to the digestive, we have what's called mechanical enzymes. Mechanical enzymes, of course, help decrease inflammation, rid our body of some of the toxic material, help get rid of what we call senescent or older cells in our body that we have difficulty removing as we get older. So the whole concept of keeping enzymes as healthy as possible makes sense, as it does, again, all relating back to that one sentence: wear and tear should always be much less than repair.
Yeah, and I talk about it as sludge kind of in the blood, all of this debris that's not being broken down, and I think that's kind of what you were talking about, right, with the mechanical enzymes?
Absolutely.
Yeah, fantastic.
This is really exciting work that you're doing, Dr. Mitch, and I wish I could just turn a switch and that all the doctors could get on board on this, so it'd be such a difference. I know that there was an example of a doctor who was coming down with COVID, and his friend said, look, I can't see you go this direction. And he gave him the massive IVs of vitamin C along with a couple of other things. And boom, 24 hours later, he was fine.
Oh, there's no question. You have to look at COVID, whether it's just a virus that occurred from nature or it's been weaponized. That's a discussion, of course, for another time. Yeah. But when you look at this, it's a virus, period. And the virus itself can be, and I've treated over 40 cases of it successfully, all within less than 4 days. Nobody on a hospital, nobody on a respirator. So we have the way. I trained 450 physicians in a webinar back in March, believe it or not, on this, because we already knew how to take care of this. And if you want, I don't mind giving the secret to everyone, or if you want them to send in a self-addressed.
Give us a secret.
Okay, you sure you want me to have them do a self-addressed self-envelope with 1995 in it first? Just kidding. Yeah, I will tell you the secret of this, and no one will get this. We have thousands of patients across the country that are doing similarly. None of them that have gotten it. And the answer is, if you can get zinc inside a cell, it will block the virus's capability of producing replicase. And replicase is necessary for the virus to reproduce itself. Now, the question is, how do we get zinc inside the cell? So you could take zinc, that's not enough. You need something called an ionophore. An ionophore is a substance that will take it in. That's why hydroxychloroquine, Plaquenil, does work. Now, if they did the study with the zinc, it absolutely works. Every doctor that's done it in the country knows that. But if you use either quercetin, which is an ionophore, very safe, it's natural, and green tea, it will take the zinc inside the cell. With that plus the vitamin D, there's no way to get this disease. And just to quickly tell you, we make our own supplements because we do this hundreds and hundreds of hours of research on it. And we made a supplement called Immune Booster, which has all of it in there. And no one that's taking it, not one in the country, got COVID.
Oh my gosh. Okay. Well, we could talk to you for a long time, and I would love to have you back, Dr. Mitch, but unfortunately we've run out of time. So just let everyone know where they can find you, reach out to you, and
how to get me. Yeah. So I'm just going to do something very simple. If you need any more information what we're using or where I am. My office is in Boca Raton, Florida, but this is the number of the office. It's 561-674-0555, 561-674-0555. And I want to thank you both, Kimberly and Patricia, so much for having me on, and it is my pleasure to be here. Thank you.
Thank you, everyone. And be sure to listen in next time, everyone. Thank you.
Thanks for tuning into our show on societybitesradio.com. Don't worry, if you've missed a show, you can find them all on our website at SarasotaHolisticChamberofCommerce.com.